Namaskar. I am glad to introduce myself as Dr. V.L.N. Shastri, retired Additional Director Ayurveda, also Principal, I did as Principal, Postgraduate Professor, Department of Ayush, Government of United AP. My qualifications: MD Ayurveda from Benares Hindu University, MSc Psychology, LLB, Postgraduate Diploma in Hospital and Health Management. Now, I would like to give more clarification on two important issues. Number one, the postgraduate qualification, one of the postgraduate qualifications of Ayurveda is MD Ayurveda and MS Ayurveda, whom I call Ayurvedic surgeons. Whether they are efficient and eligible to undertake the burden of performing modern surgical procedures as that of allopathic surgeons or not. About their competency, efficiency and eligibility is one issue. At the same time, Indian Medical Association, the allopathic organization, it comes to the field and protests the permission given to the Ayurvedic surgeons to perform surgeries. And their protest is prejudicial, biased and baseless. So these two aspects I would like to note. First, coming to the standards of Ayurvedic education, as is known to all, the fundamental course is that after intermediate BPC group through NEET examination, 5.5 years course, Bachelor of Ayurvedic Medicine and Surgery, and over that 3 years MD Ayurveda. Next, if wanted, PhD in Ayurveda. So this is the course. And about the maintenance of standards, National Commission for Indian Systems of Medicine is the apex academic authority to protect the standards and to prescribe the mandatory guidelines. Those must be followed by all Ayurvedic institutions and attached teaching hospitals and also the universities which give affiliation to the Ayurvedic colleges. So this is the background of the education of Ayurveda. Coming to the surgery, Shalya Tantra in Ayurveda. In the ancient period itself, Ayurveda for the purpose of study was divided among in 8 parts called as Ashtanga Ayurveda. Among 8 critical departments, one of the specialities is Shalya Tantra, that is general surgery. Susruta is the father of the surgery. There is no controversy, even the modern doctors also accept that. And Susruta Samhita, the ancient Ayurvedic classic, in which mainly surgical principles in detail are described. About the surgical instruments are there, about the devices is there, about the preoperative, operative and postoperative measures, Purva Karma, Pradhana Karma and Paschat Karma are there. And also the instruments and devices, Simha Mukha Shastra, that means lines, forceps, and then Kaka Mukha Shastra, that instrument simulates the shape of the crow. And apart from these things, Suchi, needle, Vrihi Mukha Suchi, curved needle, and then R Shastra, AWL all, a pointed sharp instrument useful for piercing purpose. So all these concepts are there. And also the Agni Karma, Chara Sutra application in Bhagandhara, medicated thread, Chara Sutra. Nowadays, that is a radical cure for fistulas, Bhagandhara. Even the modern surgeons also are interested to learn that, adopt that technique, the Chara Sutra application. That is one aspect. And also the other concepts in the Sanskrit terms, incision, excision, extraction, Chedan, Bhedan, Niraharan. So all these things are there, what I would like to say. So that is about the Susruta Samhita and Susrut. So when once the Ayurvedic surgeons come out of the institution, so naturally they learn in the teaching institution and the attached teaching hospitals. Even after coming out of the hospital, after getting the degrees issued by the concerned health universities, again they will acquire skill in their own interest by doing work under an experienced surgeon or an experienced physician. So this is the background. Now coming to the Indian Medical Association, I strongly condemn their protest. Here I would like to make it clear. I am not against all allopathic doctors. I am not against the allopathic advanced surgeries. But one thing I would like to say, what the IMA is, what are the points exploiting IMA by protesting the permission of surgeries to Ayurvedic surgeons. Number one, they say that how are they eligible? Eligibility means when once they pass the MS Ayurveda post-graduation and the universities awarding degrees, so naturally eligibility is there. And efficiency means already I told, very lengthy courses, BAMS, MD, all these things, they underwent and they successfully came out, and after coming out also they developed their skills in their own interest. And even then, if IMA says that they are not well skilled, then it is nothing but amounting abusing of the health universities. Even the same health universities award degrees even to the allopathic doctors also, be it physicians or be it surgeons. So their allegation is baseless and ridiculous. Next, they say that what are the boundaries of one system to another system? No, are there no boundaries? They question. But my answer is that there are crystal clear boundaries. Where is the boundary? Only while giving the prescription of medicines. Ayurvedic medicines only Ayurvedic doctors have to prescribe, and they are not supposed to prescribe modern medicines. Same is the case of the allopathic doctors. They are not supposed to prescribe Ayurvedic medicines unless the state governments have got right to give permission to practice allopathy for an Ayurvedic doctor. Or central government can give permission. Or third area is the judicial forms, courts of law. If any disputes go to the court of law, to that extent within the framework of the issues, if the court permits that Ayurvedic doctors can prescribe these medicines, then also the eligibility one can acquire. These are only three exceptions, if not boundaries are very clear. And next, coming to the patient's damage. IMA is worried about the patient's damage. Patients always, they go on making a search and they verify, and if they, wherever they are satisfied, they have got every right to choose the surgeon. If a surgeon damages his health or his life, naturally they have got every right to sue the doctor in the court of law. It amounts to medical negligence. That is there even for the allopathic surgeries and allopathic doctors also. Medical negligence, the law is common to everybody. So here, whatever be the qualifications, even one surgeon may conduct successfully 1000 surgeries. But in one surgery, if medical negligence is proven, so he is liable to be punished, be it an Ayurvedic surgeon or allopathic surgeon. So it is all, that allegation also is ridiculous. Next, coming to the public interest. Public interest is well protected by the government. The permission here, what I would like to say, all these issues why I am referring, of late, Government of Andhra Pradesh accorded permission to Ayurvedic surgeons to conduct general surgical procedures as that of allopathic surgeon. Then IMA interfered and protested. But apart from that, on behalf of the Ayurvedic fraternity of the Andhra Pradesh state, I bestow my respect. I express my gratitude. I extend my thanks to Honorable Chief Minister Sri Nara Chandrababu Naidu Garu and also Honorable Health Minister, who made a public statement to this effect, Sri Satyakumar Yadav Garu. So I thank them, and because it is a very great move in the interest and the upliftment of Ayurvedic system, we are still awaiting the outcome of the GO. So it is a known fact that unless and until Raj portion is not there, nothing can be flourished. So it's always necessary. Again, coming back to the IMA's protest, public interest is well protected by the government. After taking into consideration of all this background, the educational background and the efficiencies and practical training only, government took the decision of according permission to do surgeries for the Ayurvedic surgeons. To speak the fact, thus public interest is more protected by the government, not by the IMA. If whether IMA is it above the government to speak that public interest is damaged? So that is not there. And with regard to the poor people, with regard to the rural areas, even the so-called allopathic highly classical specialists, be it surgeons or any other physicians, the specialists are really not available in the rural areas or in the villages. So, where is the public interest they are protecting? If really IMA is bothered about the public interest, let them go to the corporate hospitals. There are hundreds and thousands of beds. Let at least 2% of the beds, 10 beds or 20 beds or 15 beds, may be spared, reserved for poor people. From them, nominal charges may be taken, if not free treatment. That is the real public interest IMA can do if it is really interested. Another factor is that instruments are not one's property, modern technology is not one's property, and surgical skill is not one's property. No patent rights over these issues, and no statute, no law is prohibiting that Ayurvedic surgeon must not perform surgeries. Because surgery is a teamwork. In a surgical theatre, all the boils apparatus or any other required equipment for the purpose of resuscitation would be there. Yes, an anesthetist, concerned specialist, qualified anesthetist would be there. Well-trained nursing staff would be there. And if really patient wants, if anybody, a person with rich money, he can establish one surgical theatre. He can hire all this team. He can hire anesthetist. He can hire one allopathic surgeon, 2 allopathic physicians, nursing staff, and an Ayurvedic surgeon to do surgery. In the mid of these concerned specialists, if Ayurvedic surgeon performs surgery, what law is he is violating? Because surgery is a skill, he can do that. While writing prescribing antibiotics if necessary, already patient has hired modern physician. Even some allopathic physicians are the friends of the Ayurvedic surgeons. They take the help of those qualified people who are competent enough to give allopathic prescriptions. That is one way out. Secondly, even strict Suchi and Suddhi, asepsis and antisepsis are maintained right from the beginning. Even Ayurvedic medicines, or good Ayurvedic medicines are there which can substitute the antibiotics, painkillers and other pre-operative and post-operative medication as per the necessity. So, there also that Ayurvedic surgeons' interest need not be protested. And lastly, one thing I say, they use some what you call humiliating words. Why mixopathy is there, mixopathy? It's not the mixopathy, because it is integration. The same Ayurvedic system of medicine, Ayurvedic physicians and surgeons are prosecuting. And wherever necessary, integrated, ekam shastra madhiyanu, like that, some quotation is there. All the contemporary sciences also, an Ayurvedic doctor should learn. You see, there is a slok in Ayurveda. So, like that integrated knowledge they are acquiring. So, it is not mixopathy, it is only the upliftment and enrichment of the science. And to speak the fact, if they use the word mixopathy, I use the word jealousy-pathy. Indian Medical Association is jealous, envious, if the permission is given to the Ayurvedic surgeons to conduct the general surgical procedures as that of an MS surgeon, allopathic surgeon. And one more important factor I say, in psychology, all the critical psychological principles are reduced into the routine terms on the way of transaction analysis. Eric Berne is the philosopher expert in the transaction analysis. He referred to some games of psychology. I am okay, you are not okay. I am better than you. These two games, the allopathic IMA is playing always. They are jealous of this. So, I take a strong objection of IMA's protest against the permission given by the government. Now, I have explained about our Government of Andhra Pradesh, which permitted Ayurvedic surgeons to do allopathic surgeries. 5 years back, central government also permitted, and what sort of procedures they have to conduct, the list is there in the annexure of the Indian Council of National Council of Indian Systems of Medicine, what I referred earlier. So, always they are very cautious. Simply because they have got license, they won't perform surgeries unless and until they have got confidence, they have got skill, and they are efficient, and they have got good energy. So, by briefing all these things. So Ayurvedic surgeons have got good knowledge and background, and they are efficient and eligible to do that, undertake that work, and thankful to the government once again. And at the same time, I strongly condemn this baseless, prejudice and biased protest by the IMA against that permission given by the government. Thank you. Namaskar.